All right, right. Welcome back. Welcome back. So it looks like I'm not screening on YouTube, so I will upload this to YouTube. But again, I am Dr. V, Benita Vernado, board certified OBGYN and lifestyle medicine physician, and your favorite holistic physician. And let's get into it. Today's topic is mental health, and I titled this episode, "Why Don't I Feel Like Myself?" or "Why Don't You Feel Like Yourself?" Now, full disclosure, I am a perimenopausal woman, so I'm in it too. I will say my lifestyle is such that I don't have the craziness that I used to. So I think if I did have the craziness that I used to, I would definitely be in this camp. However, I'm hearing a lot of stories from women as we share as women do about perimenopausal changes. And I'm so when I say why am I not feeling myself, I'm not saying like, okay, why can't I sleep or why am I gaining weight, like, or any of the physical things that are changing. I'm not talking about that. I'm talking about like mentally, like in my head, in my body, I don't feel like myself. Specifically, starting to develop issues like anxiety and depression, sometimes paranoia, just lack of energy, fatigue, which, some of that can be perimenopause, but some of that is depression. And so I want to speak to this, and I was actually speaking to a old friend, a close friend, and I've been telling her she's my muse because as she's going through stuff, she's just giving me ideas to talk about. And she'll know who she is when she watches this. But some women go through a very, very dark time, a very dark mental space where they don't want to get out of bed, they don't want to brush their teeth, they're staying indoors, they don't want to go to work. Or it can also look like functional depression, where maybe they are going to work and they're still doing the things, but it's taking a lot of effort. It's not their best work. And it's a very duplicitous lifestyle because there's a forward facing you, and then there's when I get home at night and close the door. And it can be a very sad, dark space. And so this episode, I want to speak to women who are experiencing this. As I have practiced OBGYN over the years, because I had relationships with patients, I would see this firsthand. People that did not have anxiety were having like agoraphobia, like, when they get out into crowds, all of a sudden they're not as comfortable, or they feel like people are closing in, or people who've never had depression before are really, really sad. So let's get into why you might be having some of these mental health changes. And again, we're not talking about the physical health per se, we're talking about your mental health. So what's going on in your brain, in your heart, in your mind? So let's just recap. Menopause is when you have not had a period for a whole year. If you don't have a uterus because you had a hysterectomy, but you still have your ovaries, you still go through menopause. We just can't tell you when it is. The time prior to that, where your body's like, I'm done, we're finished, is perimenopause. And your hormones are doing like this. And that fluctuation causes a lot of havoc, causes a lot of turmoil, because some of the changes can be very, very drastic. Can be very drastic. So it's a time where not only your mental health is changing, but your physical health is changing. I've shared with y'all my blood pressure started going up, and I haven't necessarily always had high blood pressure, but I also gained some weight because I'm in perimenopause. So those two go together, but there are metabolic changes that happen that can cause your blood pressure to go up. Estrogen affects all organ systems. You got receptors all throughout your body. In particular, in your brain, you have estrogen, and that affects serotonin and dopamine. All right. Serotonin is like your happy brain chemical, and dopamine is like your pleasure. Dopamine is what you get, during sex, on a roller coaster, when people do drugs, they're getting that rush of pleasure. And estrogen can cause changes in those hormones. It can cause a depletion. So, what that can look like is, maybe you are somebody who might be prone to sadness every once in a while, but when you start going through menopause, the sadness is prolonged and the intensity, the depths of the sadness is deeper, which is scary. Depression and anxiety. Depression is more of a sadness, a hopelessness. It's almost like it's taking all of your energy away. And I'm explaining this real high level. I am not a therapist, don't claim to be one. Obstetrics and gynecology does deal with a lot of mental health, but I'm keeping it high level because we have mental health practitioners that have a better understanding. But for our purposes today, very simple. Depression is a sadness that takes you down. Anxiety is more of a worry and rumination, keeps you on edge, and you're more buzzing than the sadness that you experience with depression. And you can see either because both of those brain chemicals affect those processes. The other thing that is happening in midlife is that women, so when you're in your 40s, and I'm talking on average, this is not everybody, but your kids are probably in high school, maybe middle school, still kind of going all over the place. There's a lot required of you. You're probably set in your career. Maybe you have more responsibility. You are used to managing the household. You're used to managing your job. We are great multitaskers by nature. Women are because we have to be. But as your hormones start to shift, it's like things can get overwhelming easily. Another thing that can happen at this time is your parents can get ill and, you have to take care of other people. And so life is kind of changing as you know it. Uh, the same times your hormones are changing. And then you're still trying to multitask and keep all the balls in the air. And I keep saying that, yeah, you can pick up, hormone replacement therapy or get supplements, but your life, the way you have your life structured has to change. You have to start developing some really hard boundaries. You have to do one thing at a time. Brain fog is very real. And for the purposes of our discussion, brain fog, just kind of not being able to remember things, just being a little cloudy, that's separate from the mental health discussion we're having today, but it definitely impacts it, right? So, the multitasking and letting people pile 10 things on your plate and people pleasing, that's got to stop because, functionally, hormonally, it's difficult. It's difficult for you to manage it right now. Because of the fluctuations, your brain is not as emotionally stable. So the ship is rocking, still having to do all of the tasks that it does. But also, you can be sleep deprived, which we know that sleep deprivation affects the way your brain functions. So a common thing that women are having are hot flashes and night sweats, which interrupts or impacts your sleep. And if that is the case, then you're not getting the best sleep. So therefore, your brain is not getting the restorative sleep, which is deep sleep, physically restorative sleep, which is deep sleep, and the brain restorative sleep, which is REM sleep. You're not getting that. So if you are a perimenopausal woman and starting having difficulty sleeping, I definitely recommend that you reach out to your medical provider or, a medical provider like myself who can talk with you about how to have better sleep hygiene. If you are somebody who is waking up completely drenched and soaked because you're having night sweats, those are severe symptoms. And I usually recommend that you do consider hormone replacement therapy for moderate to severe symptoms because that is the most effective treatment. Now, everybody can't take hormone replacement therapy. There are alternatives like some antidepressants. They have some supplemental things. But if you're waking up and having to take a shower, that's different. That's definitely different. This can be a temporary thing, potentially, for those of you who may be following me and are interested in holistic health and say, "I don't wanna be on hormones," it can be a temporary thing, but until you kinda get the ship calmed and righted, it's not, it's not a bad thing to consider those things that are gonna help you protect your sleep, because in order to protect your mental health, sleep is gonna be a huge component to that, a huge component to that. One thing that I need to speak to is that when this starts to happen, this is new for a lot of women. It's new and maybe it's not something you feel comfortable sharing. And so what it leads to is isolation. Y'all, I'm getting hot. I got a little fan up here. I'm a perimenopausal woman. Did I say that part? I'm hot. But yeah, I'm having a flash, I guess. Okay, hold on one second. Let's take a commercial break for a second. Just, I got to cool the neck down. It seems to be better when I cool the neck down. And I got my fan going. Yeah, that feels better. Okay. So it can be isolating. You don't want to talk about it. You maybe are still functioning and you're just doing the best that you can and asking yourself, what the heck is going on? Or maybe you're waiting for your doctor visit. Or maybe you don't have a doctor visit and you're going to wait and see that it gets better. Meanwhile, you're very irritable, you're very snappy, you're not sleeping, you're tired, your mood's all over the place, and everybody around you knows that, something is different. So, part of what I like to do with my podcast is just to encourage you that this is not uncommon. You are not alone. Any decent provider will probably be familiar with the behavioral health changes that women experience through perimenopause and menopause. Maybe I am making that's a big leap, maybe. I don't know. I'm hoping that they do know. If not, your OBGYN should know. Now, whether you get the response that you want from them as far as your next steps, you might not be aligned with your practitioner in that way, but at least I want you to understand and know that you're not by yourself. And please, please, please share with someone. So let me just say, first of all, that anxiety and depression. So some people will say, oh, I was depressed for a few days. Depression is actually a medical diagnosis. The Diagnostic and Statistical Manual, the DSM, that's where they have how you diagnose these conditions, and depression and anxiety are in there. And usually they have to last for 2 weeks. It's not like, oh, I was sad one day or I was in a funk for the weekend. That's not what that looks like. That's called just normal emotions, happy, sad, mad, glad. You like that rhyming? That's normal emotion, but depression is when things are persisting. The other thing outside of persisting for 2 weeks, you're looking at it is affecting your life and the way you function. So we can often say somebody's an anxious person. They're an anxious person, but can they get to work on time? Can they work together with their partners? Are their relationships okay? OCD is on the anxiety spectrum. So, you have some OCD people that got to go back and check the stove one time, and then there are others who are late to work because they're checking it 10 times. So when this starts to impact your normal daily activities, that's when it needs your attention. So I just want to go over a few symptoms. You have an extreme sense of hopelessness or sadness. It's just, I call it a dark cloud. There's just a dark cloud that the sun never comes out. Everything is negative. Nothing's going to work out. It's always going to be this way. And you're just in a persistent state of negativity. I think some people's personalities, I'm a natural optimist. I always see the glass as half full, as we would like to say. And some people always are more, as my husband would say, he's a realist, that, maybe the glass isn't half full, it's half empty. But some people's personalities are like that. What I'm speaking to is there is a change where, again, it starts to impact your life, there is loss of interest in things. The medical term for that is anhedonia. Like the things you like to do before, like maybe you participated in a book club or you would get together with your friends once a month. Like you just don't feel like going to those things anymore. You like rather just, sit around on the couch. Maybe you used to love to cook and now you're starting to order out all the time because you're just so tired. So fatigue is tricky in perimenopausal women because again, sleep can be poor, but you're also hormones are changing. And so, all of these symptoms, it's usually a cluster. It's not just one symptom by itself. With anxiety, you can feel real panicky. You feel anxious and on edge. You have difficulty turning your mind off. So maybe it's not a negative thing that you're experiencing, but you lay down and go to bed and you're running through the list of stuff that you have to do tomorrow. And you're supposed to be going to sleep and you're all into the next day. And what if this happens? And what if that happens? And you have difficulty sleeping, or, you wake up in the middle of the night and those things are on your mind. Those are signs of anxiety. When you keep turning stuff over and over and over, that's called rumination. It's like you're chewing on cud and you just never swallow. You just keep mashing and mashing and mashing and rolling it over, and it just really stays in your mind, and your mind can't rest. I love the way we're talking about the nervous system now, but you're calming. Your nervous system can't be calm. It's always firing, always thinking fit 5 and 10 steps ahead. Appetite changes. So this one also is a tricky one because you can increase your appetite and you just overeat. You can emotionally eat. Or I believe this is more common with anxiety. I know it can happen with depression as well, but you can lose your appetite. So you don't eat. You don't eat. You forget to eat. You start eating and it doesn't taste good. Those things start to happen. Or you are, somewhat binge eating and you're emotionally eating, seeking pleasure from food. Lastly, a sign that you're depressed is if you start to think, what if I go to sleep and not wake up? Whew, I would be so relieved if I go to sleep and not wake up. That would take a lot of things off my plate. You start thinking about, might be better if I'm not here. I've had patients, which is always so scary to me. They're driving and think, okay, what if I go over into the next lane? So when you start having dark thoughts about not wanting to live anymore, that is very, very scary. That is definitely a sign that you need help. We now have something very similar to 911. It's called 988. It is a number that you can call 24/7 if you're in a mental health crisis. And so if you are one of those people who are thinking it's dark, I don't want to live anymore, you can call 988 right now, and they can connect you with someone that will kind of talk you through and see what's going on. Please, 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 please don't ignore those signs. Please don't ignore those signs. There's something called the PHQ, Patient Health Questionnaire, and you all have probably gotten this questionnaire at your doctor's office. It's pretty standard now, but the one that most people are using is the PHQ-4 or the PHQ-9. The PHQ-4 will ask you, have you felt like you've been nervous, anxious, or on edge? And ask if you have been having difficulty worrying or controlling your worry. Are you depressed? You feel down and hopeless? And do you not take pleasure in doing things anymore? So those 4 questions, they might ask you those things when you get to the doctor first, before you see your provider. And that's their way of screening. Please be honest. Please share. There was a statistic, and I don't know if this is still true, but there was a time where people who would commit suicide, they had seen their medical provider 3 months prior to taking their own life. And so that's one of the reasons why the PHQ-9 or these screening tools are now routine in your care, because we know that life is hard and stressful, and that this is and loneliness is a big thing, and devices are coming into play, and people are suffering. Their mental health is suffering. So please, please, please There'll be that thing in you that says, "I should say something." Don't listen to the voice that says, "Keep it to yourself." So that's one of the things that you might experience at the office that is being done to help you and to identify this. And it's your time to share how you're feeling. The other thing is that, what you're experiencing may not be always directly related to menopause. You might have a thyroid condition. You might be significantly anemic. For women who are perimenopausal, your periods are changing and they can be heavy. And if you're really, really anemic, you can be really tired because your blood count is low, your hemoglobin is low. Sometimes women are turning to substances. And so, depending on how you respond to THC or cannabis, or alcohol, that can be a contributing factor. Life be lifing. Maybe your sex drive has gone down. Maybe your marriage or your relationship is in trouble because of this time of your life. Maybe you're questioning, am I in the right career? Why did I get married? All these things can start to weigh on you mentally. And maybe when you're having these life questions, you don't have a DSM-4 diagnosis, but definitely something that you need to talk through and to share with somebody and not carry by yourself. So how are we going to protect your mental health? Because I'm trying to keep these episodes to 30 minutes. So we talked about therapy. Definitely finding a therapist. I always say ask a friend or somebody you know who's had good experiences. Ask your provider. I have my own list of people that I refer to and I know take good care of my patients. So ask the people who take care of you. Consider medication. Again, this is a very special and unique transition that you're going through, and you might need an antidepressant or something for anxiety as you transition. As you transition. So definitely making sure that we're addressing, the anxiety or depression if that's something you have. Depending on the severity, HRT alone, hormone replacement therapy, might not be enough to address it. And we have to be very clear that the onset of this anxiety and depression was with perimenopause, because if you've always had issues with depression and anxiety, it potentially you may this might just be a mental health issue by itself and is unrelated to perimenopause, although perimenopause can exacerbate it or make it worse. So, be very clear about your medical history when you're discussing medications with your medical provider. Definitely protecting your sleep, getting in community, making sure that you're getting out, being with your family, being with your friends. I talk about this all the time, protecting your peace at work, putting up boundaries. Maybe, for me, I know at the height of my career, I was seeing maybe 30 plus patients a day. I got to the point where 20 plus was too much for me just to keep up with all of the responsibilities depending on where you are in life. And so we have to understand that, is there a different way for you to meet your job requirements, but loosen up the time constraints or to make sure that you're working in a flow that works best for you? Are there some things that you said yes to that you should have said no to? We're starting to learn no. When we get in our 40s, yes, no is a complete and full sentence. Yes, it is. So making sure that we are definitely putting up boundaries. Also letting your family and friends, particularly those of people that you live with, letting them know where you are, what you need. Letting them know where you are and what you need. There is a comedian, I love her. She was like, when that estrogen starts to drop, you start asking yourself, would it kill somebody else to do something around here? Why am I the only one doing all the work? Yes, ask for help. That's gonna help your mood. That's gonna help your mood. And again, trying to sleep, trying to rest, trying to pamper. I definitely am a huge proponent for exercise, particularly in the morning, preferably before your day gets started. One of the main reasons is because you get busy and we'll have a tendency to put ourselves on the back burner. So definitely exercising. if you have a spiritual practice, if you're a believer, this is definitely a time where God has not forgotten us. He is with us, and He is not surprised by perimenopause or menopause. Not surprised in the least. If He can help you, bring these children in the world, raise these children, or get the job and run the job and do all the things that you do that you've done well, then He can help you through this. I really believe that drawing on the spiritual power of a higher being, saying, I don't know what to do. This is, even if you don't verbalize it, saying that, like in AA, the 12 steps, like I recognize that I have a problem and that there's a higher power that's going to have to come in and help me walk through this. I am trying to create spaces for women to be in community and to walk together during this time of life. And that's very, very important and very healing. So if you can have a group of sister friends that you can connect with, and so, one or two people you can call when you need to, that's going to be very, very, very important. Getting rid of substances, yes. I know that alcohol, our culture sometimes celebrates alcohol. All the little napkins will have like wine stuff, and we got mamas at play dates drinking wine. But wine is a carcinogen. Yes, I said it. It increases your risk of cancer. We know this. It is not a surprise, but not something that's often talked about. And your body can consider it toxic to a point. But what about red wine, Dr. V? The little bit of red wine that protects your heart is not usually what most people are drinking. They're drinking way more than that. And it is directly affecting your central nervous system. So I'm not saying if you like it and culturally that's just what you do, you drink wine with dinner, that's one thing. But if you're turning to a substance, to alcohol in particular, to help you wind down, to help manage stress, all of these things that may need to be addressed in therapy, then I think it's time to let it go. But that's another that should be a show by itself. That should be a show by itself. But look, I don't want no hate mail, so I'm just gonna wrap up because we have hit 30 minutes. So let's see. So I just want to reiterate that this is not unusual to have some mental health changes, to feel sad, to have anxiety and depression. Just because it's not unusual and we see it, it can be new for you or it can be very severe for you. So don't blow it off as like, oh, this is just what happens in menopause. No, ask for help. Get therapy, let people know. If you're having signs of wanting to hurt yourself, call 988. You don't have to suffer alone by yourself. You do not have to suffer alone by yourself. You can, if you are interested in talking with me and you live in the state of North Carolina, go to ouywellcare.com. ouywellcare.com. That's wewellcare.com. And I offer a clarity visit and a deep dive where we look at trying to figure out what the root cause is of the issue that you're struggling with. And I just want you to understand and know this too shall pass. But there are things in your life that you can do, that you can add, that are going to help just right the ship, as we say. Right the ship, as we say. Again, I'm living this. I know what the textbooks say. I know what the textbooks say, y'all. And it's so much harder to live it. Like I know the right answers, but it's like, man, this is a trip. This is wild. And so again, I just want to give you information so you can have some control over this time in your life. So thank you so much for watching this episode of Just Say Yes with Dr. V. Please share this with someone if you're concerned about them. And again, reach out to ouywellcare.com, which is We Holistic Well Care Center, if you need more information or if you need some help. All right. All right, I look forward to seeing you all next Tuesday. You take care. And until next time, don't forget to say yes. All right, we are done.